Okay, you guys. So we're going to go over the lab portion of chapter one, of lab one. And it's similar to what we went over in the lecture. So you have your anatomical position, your sectional planes, your directional terms, your regional terms, your body cavities, and your quadrants, which we went over in the lecture also. So let's start off with anatomical position. You have anatomical position where you're standing upright, your arms are to your sides, your palms are facing forward, your feet are parallel to the ground. Anytime you describe the body, this is your frame of reference. This is where you think of, this is what you think of in your mind whenever you describe the position of the body, or where, or where things are on the body. Okay, so anatomical position, remember that. Okay, so if the body is face up, we call that supine. If the body is face down, we call that prone. Okay, so supine, face up, face down is prone. And with the sectional plane, with the planes and the sections, the plane is just a three-dimensional axis. Your section is just like a slice or a parallel plane, parallel to the plane. I'm sorry. It's used to visualize internal organization. Like I told you before in the lecture, basically we use it for imaging. Okay, when you do your MRIs and PET scans and CTs. Okay. So these are your different planes. So you have your frontal plane. Remember, the frontal plane is going to cut whatever part of the body, is going to separate it into anterior and posterior um, um, parts of the body. Then you have your sagittal plane. If it's right in the center of the body, then it's going to be mid sagittal. If it's over to the side, then we just call it sagittal. But if it's mid sagittal, it'll cut the body into right and left halves. Whereas if it's just sagittal, I'm sorry, if it's mid sagittal, it would be equal right and left halves. And if it's just sagittal, then it's just be a right and left half, but they won't be equal. Transverse cuts the body in superior and inferior halves. Okay, and oblique plane. Remember, oblique plane just comes through at an angle. Okay, so just understand it doesn't have to be through the body. It can be through the, if you just getting the plane imaging through the head, you can do sagittal plane or coronal plane through the head. You can also through the abdomen, depending on what the imaging is for. Okay. So this is a sagittal section, a picture of a sagittal section, where you remember right and left halves. So this is just that, right, looks like a right half. Okay. Um, then you have this is a frontal section. Okay. So where you have anterior and posterior portions. And then you have a transverse section here where you have superior and inferior portions. Same thing here. Okay, just a different picture, just a different look. Okay. Um, so be precise whenever you are using your terms. The importance of all of these is just to be precise. You want everybody to be on the same page when it comes to describing um, parts of the body and describing what they're going to do to the body, or whatever it is, whatever the surgery is, or whatever. You want everybody to be on the same page. So you want to be precise in your terms, spell things correctly. Healthcare professionals demand the same type of precision um, amongst each other, and people's lives will be in your hands. I don't want someone to say, you know, I'm going to cut her right foot off, and the other person, you know, is saying they're going to cut my left foot off, because they're not paying attention to whether it's the patient's right or their right. So you got to pay attention to all of the different terms and how you should talk about the body medically. Um, so this goes back a little history on why that we do things this way. Naming confusion during the Renaissance, same structures with different names in different countries, structures named after people. So if I don't know what you're talking about, then we have a problem. If you're giving me medical records and I don't know what you're saying, then there's a problem. So we got to make sure that it's standard amongst everybody. In 1895, Nomina Anatomica rejected all eponyms, which means, we don't want to name stuff after people. Each structure given a unique Latin name to be used worldwide, so everybody would know what you're talking about. Okay. The standard international anatomical terminology was codified in 1998 by professional associations of anatomists, and about 90% of the medical terms from 1200 Greek and Latin roots. Okay. So when you look at, and this is just a little table for you to kind of understand plurals and singular terms. Um, for me, I kind of picked this up as I learned what things were. If you're that type of person that just needs a table to look at, here it is. Okay. Um, so it just goes through like the difference between axilla and axillae. Axillae would be the plural form of axilla, which is your axillary area, which is under your armpits, right? Your thorax and thoraces, lumen and lumina, So just being able to see the difference between the singular and plural. So you have a nice little table there to look at. You also have your regions that we talked about again in the lecture. Anterior and ventral, meaning the same as far as the human body is concerned. Posterior and dorsal, cranial versus caudal. Cranial toward the head, caudal toward the feet. Inferior is lower on the body, superior is higher on the body. Proximal, remember, proximal is closer to the point of attachment. Distal is further away. Same thing for the legs. Proximal, closer to the point of attachment, and distal is further away. Remember, the point of attachment is the shoulder area for the arms and the hip area for the legs. Lateral, away from the midline. Medial, toward the midline. Remember, the midline is right in the middle of the body. And of course, always the patient's right and left. Okay. So this is a good picture to remind you. Okay. Directional terms. This just goes back over those directional terms that we just went over, right? They have a few different ones on here. Ipsilateral just means on the same side. Contralateral on different sides, opposite sides. Superficial is toward the surface, whereas deep is further away from the body surface. Cephalic is toward the head. Rostral is toward the forehead or the nose. Caudal is toward the tail. Okay, so that's some things that that would be beneficial for you to know to kind of go through this. Um, Same thing here. When we looked at the pictures in the lecture, you same thing here. You got your cephalic, facial, cervical, thoracic. A lot of the areas, like I said, you will pick up. Even if you don't get them all here, you will pick up. Now, it's good to kind of get them here, and because you'll pick up your muscles better, you'll pick up your bones better, because some of the names will be the same. Okay, so it's beneficial to go through what these areas of the body are, like your lumbar area, that's the lower back. Your sacral area is where the sacrum is, right? The gluteal area, I think everybody kind of knows where the glutes are. The femoral area, of course, your femur is right here, so you notice the thigh area, right? Popliteal area is the back of the knee, okay? So the calcaneus is where, you have the calcaneus bone, So, and the names kind of go with other things like popliteal muscle, and so all those names kind of come up in different ways. So it's not that hard to remember. Um, just like here, you have your thoracic area and your axillary area under the arm. So that might be something that you might need to remember. It might not be as easy to remember. Your mammary area, it was the breast area, your pectoral area, your pecs. Okay. The sternum, the sternal area. So it will, patella area where the knee is. So go over these terms. The more you know them now, the better it will be when it's time to learn the muscles and the bones. Okay, because some of those areas will come back, right? Okay, so same thing here. I'm not gonna insult you by trying to read everything to you. You can go through and look at the picture and learn the different areas. Okay. So this is what your exercises are for. It's going to help you go through some of those things, like your cranial area, your frontal, the mental, the nasal, and a lot of these, like I said, are going to be muscle names, or going to be names help you, when you learn the muscles of the face. Some of them will be the same, like the buccal area. You got your buccal area, the muscles, zygomatic and temporal. So you'll hear those, parietal, you'll hear those names in your muscles and bones. Okay. So just make sure you go through those things. Neck region, this is the cervical region. You have the anterior cervical, you have the lateral cervical, you have the posterior cervical, the sternocleidomastoid. You have a muscle like with that same name. Okay, so it's all those things. The thoracic region, like we just said, you got the sternal, the pectoral region, the axillary region. So, and the thoracic region. Okay. Um, Back regions. You have your vertebral region, your sacral region, your lumbar region, your scapular region here. So all of those things. Deltoid region. Your deltoid muscle is right there. Your brachial region, your antecubital antecubital region. Antebrachial, your carpal region. You got your carpal bones or your wrist bones, right? Palmar region, the palms of your hands. Your digital region, where your fingers are, your digits. Okay, so all of those things, okay, make a difference. Okay. All right. And the names are here, but they're really light on this PowerPoint here, but you can see them here. Okay. Same thing here. It's just going over those different regions again. Okay. Um, so make sure you go back over that. And then we talked about the quadrants, your right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Pretty easy to remember. Just kind of remember, where's your stomach in the left upper quadrant. So just kind of seeing where the different things are. Okay. Um, and here you have your epigastric region, umbilical region, and hypogastric region, right? Those are the different regions. And then you have and here's the quadrants again. And then you have to the right of the umbilical region is the right lumbar. Then you have the left lumbar. You have the right hypochondriac region, left hypochondriac region, right inguinal region, left inguinal region. So those are your abdominal pelvic regions. So make sure you go back over those. Okay, and this picture kind of helps you. Okay, where region is it in? It's in this quadrant. You see the blue lines are the quadrants, but they also say, like your stomach, it's in the left upper quadrant, but it's also in this epigastric region. Okay, so just kind of be familiar where things are. Okay, and also your body cavities. Remember, we talked about the body cavities. Okay, so your body cavities have two functions: to protect organs from accidental shocks and permit changes in size and shape of your internal organs. So your ventral body cavity, which is in the front, right? You have your thoracic cavity and your abdominal pelvic cavity. Okay, so this is a flow chart of your body cavity. So your ventral body cavity um, has thoracic and your abdominal pelvic. In the thoracic cavity, you have your right pleural cavity, your mediastinum. Remember, your mediastinum is in the center of the thoracic cavity, and the left pleural cavity. Okay, so you have your right lung, left lung. So it shows you what it contains. Your mediastinum is going to contain your trachea, esophagus, and major vessels, and then within that your pericardial cavity, which surrounds the heart, and then your abdominal pelvic cavity is going to have your abdominal region and your pelvic region. Okay, and remember, your abdominal cavity is going to contain your digestive organs. Remember, parts of your ureter coming from your kidneys. And then your pelvic cavity is going to contain your bladder, your reproductive organs, okay, and the last part of your digestive tract, right? So that's a good flow chart to have. And this same picture that we went over before: thoracic cavity, abdominal pelvic cavity, the cranial and the spinal canal are on your dorsal cavity. Okay, so you can see that here. Um, you can see your pericardial cavity in the center of the mediastinum. Okay, so make sure you know which cavities are which. Okay, here's another view. All right, so here you can see a transverse view here. Okay, and you can also see the pericardium around the heart. Remember, I told you the parietal part is the outside and the visceral part is on the inside. The part that touches the organ is the visceral part. Okay, so just remember that. Okay, same thing with the lungs. Remember, different names for different organs. So this is the pleura. So for the heart, it's the pericardium. For the lungs, it's the pleura. So the parietal pleura is on the outside. The part that touches the actual lung is the visceral pleura. Okay. Same thing with the abdominal organs. You have the peritoneum. Okay, so the parietal peritoneum is on the outside. The visceral peritoneum actually covers the organs. Okay, so the visceral peritoneum actually covers the organ itself. Okay. All right, you guys, that is the end of your lab lecture.